Good day, my POCUS friends. Greetings from Greece, where I currently reside. I am Dr. Ivica Zdravkovic from Serbia. I'm here on behalf of POCUS Academy of Serbia and at the invitation of my dear friend and associate, Dr. Vsevolod Likhin from Russia, a great friend and one of the leaders of International POCUS Academy, where we work together. I have to apologize for this leisure outfit and the dress code, which is probably not in line with the invent, but I'm here in Greece and we are recording and pre-recording this video, since otherwise we would risk the poor internet connection and potential interruptions. In any case, I hope you will enjoy your conference and your meeting and this brief message. I'm a specialist in family medicine with ultrasound certification in Serbia, in United States, and in Austria. I'm also associate professor of ultrasound and the Secretary General of International POCUS Academy, which is working as a network of national POCUS schools all over the Europe, and we also have members in United Arab Emirates, in the United States, etc., etc. I have been practicing medicine for the last 30 years, and I have been performing ultrasound diagnostics for about a quarter of a century, and I'm the owner of a private clinic where, in addition of working with patients, I have also been actively training other colleagues in ultrasound for the last 10 years. On this occasion, I would like to present you one very specific protocol which is covering head-to-heel examination of patient, and we designed it in POCUS Academy of Serbia mainly as a guideline curriculum for training new colleagues in the ultrasound. We named this protocol PROBE, which is the synonym for transducer. The Serbian word would be sonda, and the probe is actually an acronym which consists from the initial letters, which I will explain later by using the slides which I had prepared. As you can see in this slide, once again, the PROBE protocol is an acronym which is actually meaning POCUS, point-of-care ultrasound, rapid overall body exam. It consists of 5 parts. Examination begins with echosonography of the neck, which includes thyroid gland, carotid arteries, and of course lymph nodes, salivary glands, etc., etc. The second part is lung ultrasound. After we perform the lung ultrasound, we move on to the focus-assessed transthoracic echocardiography, or the FATE exam, the examination of heart. Then we move on to abdominal examination, including the pelvis. And finally, we finish with the Doppler of the lower extremities, looking for deep vein thrombosis and assessing the arterial blood flow. We like to say that the PROBE protocol is actually covering FATE, EFAST, RUSH, BLUE, and other more familiar protocols, and protocols usually presented and taught in POCUS and ultrasound schools. The first letter in our PROBE protocol stands for POCUS. The second one stands for rapid, and this indicates the desire to perform a fast assessment of a gross pathology through head-to-heel examination, relying solely and mostly on standard tools available on all ultrasound machines. And this makes a clear difference between the PROBE protocol and, for example, the cardiologist's echocardiography, which can be very comprehensive and detailed examination in contrast to what we do. In line with this philosophy, we are primarily focused on qualitative rather than quantitative evaluation, and we rely on measurement by comparison. So we are using the structures with a relatively consistent size to compare them with the changes that we see on our ultrasound monitors. So here is an example of a thyroid node, which is roughly compared with trachea and with carotid artery. And if we know that trachea is approximately 20 millimeters wide and carotid artery is approximately 8 to 10 millimeters in size, then we can obviously conclude that this small hypoechogenic node is probably somewhere at around 10 to 12 millimeters, which classifies this thyroid change as a TRADS2 or benign change. In assessing the level of stenosis in carotid arteries, we sometimes use fractions instead of exact percentages, like 1/2, 1/3, 2/3 of stenosis. And we can see on this image that this carotid artery has a stenosis near to 2/3 of the lumen, which classifies it as a borderline for probably operation. National and international guidelines recommend surgical treatment of stenosis of 70% and above. Now, without trying to go into further details about the lung ultrasound examination, FATE examinations, etc., I just want to point out that we strongly believe that PROBE protocol is particularly useful in geriatric patients and in those with symptoms of unclear etiology that could arise from multiple organ systems. A good example here would be a patient who's elderly and with a history of diabetes and hypertension, who is overweight and a smoker, and he is with symptoms like lightheadedness, insomnia, fatigue, leg swelling, and digestive discomfort. So it's obviously that when observing and examining this kind of patient, we have to approach holistically, meaning we have to check everything, the thyroid, the metabolic status, the carotid arteries, the heart size, left ventricular systolic function, lung parenchyma, looking for all sorts of acid, free fluid around the heart and in pleural recesses, and for everything else that we can find using this protocol. As I previously said, the PROBE protocol is overlapping with the more known protocol like EFAST and RUSH. Especially RUSH is very important to us because of the so-called tank, pump, and pipes part of examination, where RUSH includes the assessment for deep vein thrombosis. One additional comparison is that PROBE protocol is practically expanded PEARLS protocol. The PEARLS protocol was developed in the United States by Michael Wagner and Janice Bolton, and it is also an acronym, and the mnemonic image here shows us the positions where we are setting and placing our probe in order to examine the pericardial area, epigastric area, anterior lung fields, right upper quadrant, left upper quadrant, and suprapubic area. And as you can see, it's basically a combination of abdominal examination plus FATE plus lung ultrasound. So the PROBE protocol would be once more expanded version of PEARLS, which includes neck ultrasound, PEARLS, and Doppler of legs, blood vessels for deep vein thrombosis and peripheral arterial disease assessment. The PROBE protocol is being used in clinics in Serbia for a couple of years already, and through our workshop and seminars we came to the conclusion that approximately 60 hours of training or some 10 working days are required for our students to learn the skills necessary for performing accurate probe protocol examination. We have successfully demonstrated when performed by a well-trained sonographer, the probe protocol can be completed in as little as 6 to 10 minutes, depending on the pathology found during the examination. And when our colleagues complain that the ultrasound examination is time-consuming, this is an excellent argument, and we always say it's only a couple of minutes. Please learn how to use the ultrasound. In addition to the skills taught within the PROBE protocol, our POCUS Academy of Serbia also offers training in what we call the PROBE Plus, which includes additional fundamental POCUS examinations, rapid orientation and targeted musculoskeletal pathology assessment, focused breast lesion examination, rapid scrotal examination, and more. Beyond diagnostic POCUS, our academy also provides training in ultrasound-guided procedures, particularly in anesthesiology, orthopedics, and other fields. I hope I haven't taken up too much of your time. You can follow the activities of our International POCUS Academy on Facebook as well as through our website. I wish you much success in your ongoing work. Have a pleasant day, a nice summer day, and I send you warm greetings from Greece and from Serbia. Bye-bye.